Hello friends, today we are going to talk about our journey during the COVID times. On 25th of March 2020, we were supposed to celebrate our 25th year of existence in Chembur as a multi-speciality hospital called Dr. Das Hospital with a program at the auditorium of Tata Institute of Social Sciences. On 13th March, we were informed that all programs of mass gathering were cancelled due to COVID. Although COVID had come in the world around the beginning of the year, India got the influence of COVID only around March. So we cancelled our program. This happened about 272 days ago. During this period, our hospital has functioned non-stop as a non-COVID hospital. How do we manage to keep it non-COVID? We initially have a phone triage with the patient who's having a problem, and we ask relevant questions like loss of sense of smell, loss of sense of taste are the first things which come in. Later on, they have stuffiness of the nose. As you all know, fever comes in after that. So when we find that on the phone, we tell them that you stay isolated, and we give them methods of diagnosing COVID-19. How do we do it? We tell them to go to a CT scan center to do a chest HRCT and do a RT-PCR, which is a nasal swab at a relevant center, a good center. In our hospital, we have a good center which comes and does COVID testing, RT-PCR, regularly at 10 o'clock in the morning, and sometimes in emergency they come also at night. So this was the beginning of COVID times, which was about nearly 9 or 10 months ago. So along with triage, we had an isolation area on the third floor of the hospital where people would come in, we would check them up, and if we found that they have got any signs of COVID, we would do the same thing for detection and isolation. And then at that time, the information to the municipality was an essentiality, so we would inform them. Things went on changing, and even the municipal laws went on changing from time to time. And all along, we were well abreast with the rules and regulations of the COVID disease, thanks to the medical officer of Chembur, Dr. Bhupendra Patil, who was excellent in guiding us at every point. So we have a hospital on 2nd, 3rd, 4th and 6th. On the 2nd floor, we created isolation beds. So if the patient came in after infection, we didn't know it is COVID, just fever, and often they would come with just loose motions. So we would admit them and keep them on isolation, get the test done. Test normally took about 24 hours for the results to come in. Once the results came in, if they are COVID, we would refer them to the medical officer of municipality who would guide them to a COVID center. This was the beginning of our experiment of keeping our patients safe. We not only did the telephone triage and isolation, we also started informing the patients through our media, that is Facebook, presence Dr. Das Hospital, which is our Facebook page, and www.dashospital.com, which is our website. Regularly we would inform them. We also used to have broadcast news on WhatsApp to all our patients regarding whatever changes are happening. This was the beginning of the COVID times, and gradually we realized that we could detect COVID and isolate them. Of course, there are some cases where we did not suspect and they had it, but because of our excellent isolation, we didn't expose other patients who were admitted to the disease. Along with the care of the patients, we also had to take care of our staff because they are very important to us. We have staff strength of about 50, out of which about 20 of them are there with us for more than 10 years. So taking care of the staff was a very essential thing in our program. We gave them PPEs, we gave them masks, and not just ordinary PPEs, we gave them 80 GSM, which was comfortable and also safe for the patients. We gave them masks which are of good quality so that they could wear it and be safe. We took lectures for our staff about what this disease is because it was something very new for them. So we informed them. As we got the information, we disseminated it to the staff so that they could understand the disease and take care. As you know today, the dangerous part is to touch the mouth, the eye and the nose. Easy to remember, men, M-E-N. So you don't have to touch these three parts with your hand, because hand will touch surfaces. You can wear gloves whenever required, and they also wear gloves whenever required. Care of the place had to be taken. We had to make this place safe for patients. There are patients who would come to our ICCU, and when they came into the ICCU, it was difficult to make out whether this breathlessness was because of COVID or another disease. A patient who's got a congestive cardiac failure or left ventricular failure should not be denied admission. So we closed down our ICCU for a month. We made an isolation unit in the ICCU with a HEPA filter and a negative pressure. This basically was a negative pressure area where patients came in with suspect COVID and stayed there. Now, in our small, well-equipped hospital of only 45 beds, we could do all this because of the cooperation of all our staff, the nursing staff, the assistant staff, the doctors who are RMOs, and also the accounts and administrative staff. We had a matron who was excellent in managing all the systems in order. Then we also changed the things in the operation theatre. We got in a smoke evacuation system, which took away the smoke which occurred during surgery, because the smoke can contain a lot of toxic substances. We also made an anesthetic gas evacuation system, which took away the anesthetic gas, because the gas goes into the lungs of the patient. Although we are checking them, still we did not want any chance, so the gas goes out. This gas which goes out goes through a system and it goes out after filtration into the atmosphere. So in the short, we also took care of the place by making it more user-friendly for patients who wanted to be safe. And believe me, today, after 272 days, we have not had a single patient who has developed COVID after being treated by us. At the same time, in the 50 staff who are there, none of them have got COVID from the hospital. So if you make your place safe, you are safe, your patients are safe, and your staff are safe. That is what we did to make it the way it is today. Now, the time has come when things are relaxing. People are getting more relaxed with the idea that COVID is going away. No, 2020 is going away. But COVID-19, which came in 2019 all over the world, is going to last till 2021. Yes, the vaccine is coming in. But this vaccine is not tested well yet. They have tested 70,000 people, 80,000 people, 1 lakh people, out of which half were placebo. That is not the vaccine, a half were vaccine. They did a double-blind study. So you have a very small population which has been tested. Now when it goes into the market, when it goes all over the world, UK has already started, other countries also will start, and when they give the vaccine, we'll come to know two things. One is the efficacy of this vaccine and for how long. Two, the side effects of this vaccine. There are two types of vaccine. One is life attenuated vaccine, which is the virus which is made weaker and then injected, like your polio vaccine. And the second thing is the RNA vaccine, mRNA vaccine, which will actually enter the cell of your body and change certain patterns. Is it going to be safe? Is your prototype going to change some way? It is yet to be seen. So therefore, my opinion is that keep safe, stay healthy. Don't think that vaccine is going to make you a Superman. So again, before we meet the next time, I would still request you to stay safe and stay healthy. Thank you very much.